This topic is related to isolation and quarantine. The guidelines have just recently been updated. Recently, the CDC has updated their guidelines as of January 26, 2022. And the reason for these changes is because of the changing trends and the increased spike in COVID, even though people are being more vaccinated now than before. So the recent accommodations are now going to be elaborated on. Isolation, which is a sign for isolation, means any individual, regardless whether they have been vaccinated or not vaccinated, and has tested positive, must isolate. The CDC guidelines now state that if a person tests positive, they need to remain home for the first 5 days. And if you live among other people, such as friends or family, you need to wear a mask at all times while you are in isolation in that household. Once you pass the 5th day and you experience no symptoms, you are free to go out and about and return to work or school or whatever the case may be, with the understanding that you must continue to wear your mask for 10 days, 5 days at home, plus 5 days out in public. You must continue to wear a mask all during that time. If you are still symptomatic, you need to remain home until you are symptom-free and you feel better. Once you can go by 24 hours without experiencing any symptoms, then you are free to go out and about again. Now, speaking about the requirements for quarantine, the update guidelines state that there are 2 categories for quarantining. And the first one is for those who have been not yet vaccinated or partially vaccinated, meaning that they've gotten 1 out of the 2 but haven't received the booster. The definition of quarantining as it applies to those people means that you have been in contact with somebody who has tested positive, and then you are considered close contact. So therefore you have to self-quarantine for yourself. The guidelines state that if you have come into contact with someone, you need to quarantine yourself for the first 5 days wearing a mask, because of the fact that you may be living with people or other roommates for the first 5 days that you are quarantining. After the 5th day, you experiencing no symptoms, then you are free to go out and about in public as well, with the understanding that you must wear a mask for another 5 days and to get tested to make sure that you are not tested positive, because previously you were not tested and you basically know that you came into contact with somebody who was tested, therefore you must be tested. Now, the second category is for the people who are fully vaccinated, which basically means the definition of fully vaccinated means that you have received a Pfizer or a Moderna vaccine and you've had your 2 doses plus your booster. Or you received the Johnson & Johnson, your 1 vaccine plus the booster. Now, the rules have just changed recently for fully vaccinated. Previously, in the past, fully vaccinated meant that you had your first 2 vaccines with either Pfizer or Moderna, or your 1 vaccine through Johnson & Johnson. That was considered fully vaccinated on a previous definition. But all 3 categories have now changed under a new definition, meaning that you must have Pfizer and Moderna, the 2 dosage plus your booster, or the Johnson & Johnson plus your booster, to be considered fully vaccinated by definition. So if you have not received your booster, then you are back in the category of being classified as not fully vaccinated. Now, the guidelines state that if you come into close contact with someone who's tested positive, do you have to stay quarantined? Not necessarily. You can go out, but you must wear a mask for 10 days. You can go to work, you can go shopping, you can go out and about. But in the house, if you're among family members, you need to wear a mask at all times for sure. If you're alone, then you don't need to wear a mask. And on the 5th day, you should go get tested to ensure, in fact, to find out if you are positive or negative. If you begin to experience any symptoms in the 3rd or 4th day, then you need to stay home and take the test afterwards after you subside from all your symptoms. That is the new guidelines that has been updated by the CDC. Now, if you plan to travel outside the state of Rhode Island to another state within the United States, or travel outside the continent of the United States, the rules and requirements and guidelines are changing week by week. Each country and each state are going through different changes. So there's just too much information to bring up to date as of now. So I suggest that you go to the CDC website to find out what the standards are before you go on your travel. Now, the Rhode Island Department of Health has their own travel website information page, and their website is as follows. Or you can go to the CDC website, and they also have a travel page listed on their website, and they will tell you which countries that you should not go to and which countries are considered safe to go to. And their website for the CDC travel page is as follows. Remember, if you follow the guidelines of the CDC, we can actually control the spread of this COVID variant and go back to close to normal as possible. Stay healthy, stay well, and thank you.